Joining us now is Dr. Mark Kline. He is the physician-in-chief of Children's Hospital, New Orleans. Dr. Kline, thank you so much. Appreciate you joining us. And we just heard in Victor's report something that you said about your hospital, an epidemic of very young children. So please, sir, tell us what you're seeing right now.
Well, Robin, this is not your grandfather's COVID. This Delta variant is an entirely new and unexpected challenge for us. It's affecting a lot of young people. We've seen the prevalence rate of COVID positivity among children at our hospital rise from 1% to 7% and now to about 20% over the course of the last 30 days. And we are hospitalizing record numbers of children. Half of the children in our hospital today are under 2 years of age, and most of the others are between 5 and 10 years of age, so they're too young to be vaccinated just yet.
And are these cases with children, are they more severe than you've seen in the past, Dr. Kline?
They are. We're seeing quite severe illness, and so we can say that this virus is more contagious for sure. What we don't yet know with certainty is whether it's more virulent, but certainly to my eyes and I think to what others are seeing across the region, children are experiencing more severe disease than they have in the past. They come in respiratory failure. They often require hospitalization in the pediatric intensive care unit, and a number of them have required mechanical ventilation.
And I know compounding the situation for you there is that a number of your nurses are out with COVID diagnosis, and you have a federal team that is coming in quite soon. What are your immediate needs, Dr. Kline?
Well, what has become rate limiting for us, Robin, is staffing. It's not PPE or mechanical ventilators or anything of that sort. It really is the availability of nurses and pharmacists and social workers, and we were thin already. We had lost a number of staff over the course of 2020, and we've been working hard to replace those. But Louisiana and the region as a whole have a real dearth of professionals. And now we've lost about 60 of our professionals to COVID over the past several weeks. And so we're thinner than ever before, and this is obviously putting a real strain on the system.
Obviously, and you've said children, many of them, they're too young to be vaccinated. So what can be done to prevent the spread to these young children?
Yeah, you know, we've got to continue to practice the mitigation measures that we have from the beginning of this pandemic, distancing, meticulous hand washing, and masking. But I'm worried at this point that this virus is so contagious that these mitigation measures may not be sufficient. And it's really incumbent on adults and older adolescents who are eligible for vaccination to get the vaccine. These young children, kids 7 weeks, 10 weeks, 3, 4 months of age that are hospitalized at Children's Hospital New Orleans currently, they have to be protected by the adults in their environment and essentially cocooned to stay safe. And so we need adults to step up. If they're not going to get the vaccine to protect their own health, they should do it for their families and for these young children who are the most vulnerable among us.
Hopefully people will hear your message this morning. Dr. Mark Kline, I know you and others are working hard there in New Orleans. Thank you so much, sir. Wishing you all the best.
Thank you.
Okay, take care. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.